So in Nagpur or in Vidarbha, you must have heard there is a strong heat wave. In Nagpur, the temperature is close to 47 degree, and if you go to the streets between 1 o'clock to 5 o'clock, the streets absolutely deserted. There is so much heat, and most of the patient comes to us in these type of scenarios basically to give some preventive medicine for it or symptoms because of heat. For example, the patient may get symptoms of pain in the abdomen with diarrhea, and the diarrhea is very offensive. Sometimes the patient comes with tremendous weakness because of the sun. Sometimes the patient comes with fever, very high fever, 103, 104. Sometimes the patient comes with a lot of malaise and pain in the joints. Sometimes the patient will come with severe headache, throbbing headache. So these are basically the conditions where homeopathy has a very good role in treating cases. In general, if you see symptomatically, the most important symptom, the patient would come to with severe headache. The patient from here goes to maybe 1 kilometer and does not wear the helmet or he's not wearing anything. He goes in the sun and he comes with a severe headache, especially those cases of migraine which are very good with your treatment. Suddenly in summers develop a lot of headaches. So in these type of cases, few remedies are very important. The patient comes to you and says, "My God, so there is so much headache. There is redness of eyes, throbbing of the carotids, and red face because of the heat." He goes and the mother says, "My God, you're looking like a tomato." Immediately think about belladonna, a very important remedy for sun headache or sunstroke. Second remedy, again very important for sun headache. Think about glonine. The patient comes and says severe headache, severe pain in the eyes. The eyes are so painful, so heavy, they are hardly able to open the eyes. Think about gelsemium. Sometimes the patient comes with severe headache. The patient comes in front of and he has severe headache like this. This I went to the sun with severe headache and pulse. And you must think about Veratrum viridi. The patient suddenly goes home and just collapses because of the heat. He becomes absolutely, a cold and clammy sweat, cannot open the eyes, close to becoming unconscious. Think about camphor, my dear friends. Depending on what the symptom the patient is suffering from, then you have to strike the remedy. So I hope everybody is receiving cases of heat stroke, sunstroke, and you must have also the experience in treating cases of symptom related to headache and sunstroke. Remember one remedy, antim crude. It is written that antim crude is headache from river bathing, or you can say headache from taking cold, or headache from taking alcoholic drinks. So whenever the patient comes from heat stroke, from the heat of the sun, goes home immediately, opens the fridge, takes the bottle, gulps the whole bottle, goes in the bathroom, takes a cold water shower, comes out very weak, and then starts getting headache and fever and XYZ. Think about antim crude. You can't expect river bathing and all, but in this case also think about antim crude, my dear friends. Okay, so welcome Dr. Moria, Dr. Uppal, Dr. Vishaka, Dr. So these are very important symptom in relation to sun and head symptom, that is headache. Some patient might get lot of weakness. The patient is so weak because of the sun, he just cannot do anything. And if there is a typical symptom, heatness from the heat of summer, heatness from sun, you can say, the 47 degrees Celsius, you cannot go out, you can see, nobody on the road. So whenever the patient comes with weakness because of the heat of the sun, three remedies are very important, my dear friends. First, think about gelsemium. Second, think about natrum carum. Third, think about arsenic, and also you can think about selenium. So I have a very interesting question. And thank you for asking questions. Otherwise I keep on telling you remedies in YouTube also and in Instagram also, and I cannot take the questions. So one symptom, itching and eruptions after a typhoid. Now this is again a very the most irritating disease sometimes is basically treating itching, and the patient has a normal symptom. बहुत खुजली आती, itching. There is burning, there is a discharge of discharge of blood, and everything is same like that. Now you have a specific question, itching after typhoid. Now if you are treating a case, and if it comes to homeopath, he is classically telling you itching after typhoid, and there is no other symptom in relation to itching, but only itching after typhoid. You can simply take that medicine only, my dear friend. And which remedy I am talking about? That is typhoidinum. So we have that tautopathy type remedy, typhoidinum. You can basically prescribe typhoidinum, and you might get good results with that. Otherwise, you can think about carboveg, you can think about calcarea carb, you can think about sulfur, and you can think about melendrinum. I have found this in my practice very useful. One patient had, after typhoid, there was lot of itching, lot of eruptions on the body and reddish. In that case, I prescribe the patient Apis mellifica, and the patient is much better. So you can have the direct symptoms also. Medicines for dehydration and sodium loss due to heat. Yeah. So see, whenever there is a mechanical problem, you can see that because of the heat, the patient has basically not consumed so much of water, so much of fluids, and he feels absolutely dehydrated. You can check from the skin whether the patient is dehydrated. In that case, you can start homeopathy medicines like natramur, salts also like 6x potency, biochemic 12x. But I would suggest in this case, you can start some oral rehydrating fluid, ORS or YTLIVE, or in some cases, you have to put the patient on saline also, either ringer lactate or normal glucose also, because there is a mechanical problem, there is dehydration. So in this case, you can also think about these complaints. Upper back pain. I hope real matter you've got the answer. Now upper back pain, see, in homeopathy, of course, there are basically remedies for the specific areas also. But if you ask me, don't try to prescribe on too much part of upper back, lower back, middle back and all. So you will sometimes become confused what to prescribe and what not to prescribe. But if you want exactly the same medicine, then you can prescribe, pain in the trapezius muscle, pain in the cervical region. So in these type of cases, there are few remedies which are very important. Of course, in homeopathy, there are remedies which are very commonly used in basic problem of back and all. So just type pain and you can get the remedies also. You can type cervical pain or pain in the trapezius muscles, and those pain remedies you can prescribe. Speaking about the remedies, you can write down some remedies which are very commonly seen and practiced in my OPD also. The first remedy you must think about, of course, is Macphos. Second, you must think about is Calcarea carb, Agaricus muscarius, Strychnum fos, Naxomica, Rustox, Bellispur, Ruta. Very commonly prescribed. Something which in relation to constitutional medicine that you must think about is Calicarb, Califos, Sulfur, Sepia, phosphoric acid. One case I remember where the patient had severe pain in the upper back, in the trapezius, and the patient had a typical symptom. He told, sir, whenever I am working, I am typing or working, and the pain starts. So this is a classic example where pain aggravation from exertion, and the remedy I prescribed was Berberis vulgaris. Okay, so after simillimum, anything useful for lipoma, sir, or any simillimum? Yeah. First of all, I have also cases of lipoma. Let me also tell you that difficult to treat, but I have lot of cases with the patient is gradually becoming better. Of course, it takes time. I had just in the morning also case where the patient was a doctor. He's taking medicines for 2 years. Lipoma around 50 to 60% better. Previously they were very hard, and then they became soft. So with the constitutional medicine, I've always told you, if you want to prescribe, you can think about thiocinamide. Thiocinamide is exactly sometimes becomes a synonym for lipoma. I normally use thiocinamide now in LM potencies. I start from 0.1 and continue, and then in between doses of antipsychotic medicines, either Thuja or Medorinum or Natrum sulf, depending on the case and symptoms. I see many drunkards with fibrosis in liver. Please guide complete protocol with medicines. Yeah, doctor. Very, very interesting questions, and very, very true that lot of drunkard have this problem. But I would like to add one thing. I have cases where the patient not taking non-veg, the patient not drinking also, still the patient gets cirrhosis of liver. Secondly, on the protocol, homeopathy basically, if you ask me, don't follow protocols. There are doctors who will tell you protocols, they will show you on the webinars. The doctor goes, the protocol goes. So there is nothing authenticity in that. If there is no authenticity, then please don't follow it. I've always tell you, if you want to follow a doctor, don't follow him because he's good in seminars or webinars or in social media. Try to find out how is his practice. Try to go in the clinic and see exactly whether the patients are there, whether he's giving the results, what he's speaking. That is very, very important, my dear friends. Third, now regarding the treatment. Now, if you have told me, regarding cirrhosis of liver because of drunkard, so simple, you just make sure that the patient stops drinking first. That is very, very important. And secondly, then depending on, in this case, you can use some liver tonics also. And I have cases where I have not cured cirrhosis of liver, where the viral count was very high and the patient is much, much better. So what the patient does, he goes to allopathy also and homeopathy also. Now we give a constitutional medicine, but allopathy doctor gives him the tonic, so he starts taking tonic also. And believe me, the patient is still better with that. So maybe you can give a homeopathic tonic also, any tonic which acts on liver, and your constitutional medicine. In this case, just remember one thing: there are times where the patient suffers from some acute symptom, either in the abdomen, pain in the abdomen, diarrhea, dysentery, blackish stools, offensive stools. In that case, your acute prescription has to be good, because every time you cannot give a constitutional medicine and tell him to basically treat, basically the cirrhosis. Now, Boerevia diffusa. Now, Boerevia diffusa, it's called Punarnama, very beautiful literature, but I have not seen any result with this medicine, so I cannot comment on that. Okay, I have not seen results. High BP with fainting, breathlessness, weakness, chest pain, Oromet 1M cured in the past, but now it is not curing with Oromet 1M. See, high BP with fainting and breathlessness and chest pain. Now, my dear friend, this becomes basically, an emergency condition. Oromet basically is a constitutional medicine, and I know you must have prescribed properly, but in acute conditions, it is important to prescribe some acute medicine so that the patient comes out of that situation. Then after taking the case, you can always prescribe the constitutional medicine. In this case, there are few medicines that you should take care of. First of all, think about Rauwolfia, think about Belladonna, think about Veratrum viridi, a very, very important remedy. Think about amyl nitrate. These are some acute medicines you must think about, and then when the acute symptoms have been taken care of, go and prescribe the constitutional medicine so you can treat and cure blood pressure. I am telling you that because I have a lot of cases where I have not able to treat blood pressure, but the patient were on 2-3 antihypertensive medicines. I have reduced those, and the patient is now only on homeopathy treatment. So you can definitely treat blood pressure properly. Sir, cough in throat in morning and after eating aggravation, expectoration after cough emulation. What to think about? Now, see, you have two questions. Cough basically in the morning. So whenever you have cough in daytime, or you can say cough when waking up in the morning, there are 3 or 4 remedies which are very, very common. So whenever the patient comes and tells you the cough aggravated in the morning, okay, you must think about first drug is ammonium carb. Think about arsenic. Think about calibichrome. Think about sulfur, think about pulsatilla, think about calcarea carb, think about squilla. Now, in homeopathy, if you go to see the literature, we have specific timings also, my dear friend. 6 a.m. I had a very interesting case. The patient used to tell me, sir, 6 bajte hai. If it is 6 o'clock, my cough starts. And beautifully written in a Mater Medica, coccus cacti, and that treated that case. So we have 6 o'clock, 7 o'clock, 8 o'clock, 9 o'clock, though I always tell don't prescribe on that timings, but if the patient is classically giving you timing, then you have no option but to take that for prescription. Now, expectoration after cough. You see, my dear friend, a lot of cases you'll come in your practice where the patient says expectoration ameliorates, and this is a very common symptom. If you read the books of medicine, whenever the cough comes out, the chest feels clear and the patient is happy. So if you get a chance, don't prescribe on expectoration ameliorates. That is my opinion, because this is a very common symptom. So in spite of prescribing on that, do prescribe on the modalities like morning or timing, and what excites cough and what are the triggering factors of cough. Then you'll be able to treat that patient better. Okay. You have passion to treat without irritation. That you have to ask my doctors who are working with me, who have joined me since years. Doctors come with me, and my way of teaching is that I always tell them, you see the case, you take the case, you interpret, I'll help you to interpret the rubrics, and you see the result whether it is working or not. So if you ask any doctor who has worked under me, he would like to tell you that more of clinical approach. What is written in books is very, very important, but everything we don't apply. So it is nice, to share knowledge so that clinically they improve and clinically they show good results. That is important for me. But there are some students, and some doctors also on webinar, they sometimes irritate, asking the same question, asking me good medicine and specific medicine. Sometimes I do also get irritated, but then I've been teaching for years, so I know that happens. Okay, it's so important. Zinat Kausar, yeah, ji sir. So I hope you understood that. Of course, in expectoration, I would add like one thing, that if the expectoration is very, very peculiar. For example, if the patient says expectoration is like balls, it is the shape of a ball. Now, if you open your Mathematica, expectoration with the shape of a ball, 3 remedies I have seen very, very fantastically indicated. First is Urgentum nitricum, second is Coccus cacti, and third is Stearum metallicum. So sometimes the patient says that my expectoration is like ash colored, earthy colored. So we have remedies for that. Expectoration is blackish in color. I remember that because I had a case where the expectoration was blackish in color, and I prescribed the patient Elapse, and the patient improved very well. So this is important rather than prescribing on expectoration ameliorates. Of course, that is my opinion. That is my practice. That is what I have seen in my practice. Okay. So let us go forward. Few questions more before we wind up. Oh, it is only 15 minutes, so you have still 10 minutes to answer. Now, going further with that, there are some cases where the expectation is sometimes like bloody streaks and all. So also take that into prescription. Okay. Yeah, it's okay. So if there are no questions, then I would still add in regarding to the color of expectoration. There are remedies where the color of expectoration is very, very important. For example, of course, I also don't go and ask the patient what is the color. It is brick dust or reddish or pinkish, because he may not able to answer that question. So which is very, very simpler to understand, simpler to see, and the patient can be able to tell you that problem. Please ask that question only. For example, the patient says the expectoration, Dr. Sahab, is very, very yellow in color. Very easy. Expectoration is grayish in color. Easy to see. Expectoration is greenish in color. Very easy. So these type of things which are very easy to understand, don't ask the patient how it is. It is brick red color or liver color or pale in color. He'll not be able to appreciate that type. No, so we have rubrics like liver colored expectoration or pale colored expectoration or pinkish expectoration, rusty expectoration. So I don't go into detail of that, because if there are very hairline difference and the patient is not able to describe, then your remedy is wrong. See, so this is also very important what to take. Otherwise, take general prescription, yellow in color, white in color, red in color, greenish in color, blackish in color. These are very, very easy. Okay, so I hope you understand that. Yeah, nice topic, because I have failed in my practice so many times, doctor. That's why after the failures, then I started understanding how to prescribe and what to prescribe. I had a case where the patient told me, that was years back. The patient told me my expectation is yellow in color, and because my Mathematica was good, I said yellow or lemon colored, and the patient said lemon or yellow. No sir, lemon is yellow. So when you are asking the patient lemon color or lemonish yellow or yellow, whatever the patient has told you first, yellow in color, take that. Okay, otherwise he'll be confused what to prescribe. Okay, are you with me? Are you understanding, my dear friends? So try to make the patient very easy so that he can understand. That is very very important, my dear friend. Otherwise, I have seen good practitioners and unnecessarily making chaos of the case, which I also had done before. That's why I'm telling you, because I have failed. I want you should not fail. You should be able to give the right medicine on the first instant only. That's very important. And remember one thing also, that's in some cases, the patient will classically tell you that, sir, whenever I eat food, after eating food, I have expectoration. In that case, 2 or 3 remedies which are very very important, because there is a classical modality, especially after eating. Okay, think about phosphorus, think about lycopodium, and think about thuja. These are the remedies which I have basically used when the patient classically tells you expectoration after eating. Okay, so let us go forward. Do ask some questions. So otherwise, I feel that everything is answered. So my webinar is over. So don't make it that way, because we have still 5 to 6 minutes to go. So anything regarding to any other questions? I have some questions. I have not scrolled up. Dr. Moria, I hope your answer is, I think, exhaustively answered. Yeah. So something about Punarnama. Yeah, it is written in literature, very well, but I have not seen any results. Same, I would like to add one thing, that there's written in literature about a remedy where it is written that it generates the beta cells. Case of diabetes, that is the remedies, gymnema. Okay, but I have given gymnema in all possible ways, but I have not seen results. So sometimes it is written in books very clearly, but clinically we have not seen the results. So that's why I told you I have not been able to give results with Boervia, so I will not comment on that. Okay, heartbeat after eating. Uh, Heartbeat you have after eating also and before eating also, because if there are no heartbeat, then there will be a problem. So it is, you can always just improve your question, my dear friend. You can say palpitation after eating. Okay, and of course, you can add some symptoms more, because just palpitation after eating, sometimes, because of a lot of congestion and a lot of bloating, the patient eats food, and the diaphragm comes up because of the gases and the bloating and the distension. So there is palpitation. So if you just ask the question, which is again very very important, palpitation when the patient, when मैं बहुत दुखी हो जाता हूँ, when I'm very sad, when I'm passing through an emotional trauma before the exams, or somebody is expired. Now that would be a very easy question, important question. Palpitation from emotional complaints. But of course there are remedies, my dear friend, where there is palpitation after eating. If I'm not wrong, the remedies are calcarea carb, lycopodium, pulsatilla, naxomica, natrum carb, carbovage, because these all remedies are for gases problem. Okay, I had a very interesting case, where the patient used to come and tell me that, sir, I have a lot of palpitation, and I have a habit of eating too much food. I can eat the food beyond the capacity of digestion. Same palpitation after eating. In that case, I gave the patient Abies canadensis. Okay, and just to add to you, doctor, palpitation from emotional complaints. Then you must think about Califos, Ignatia, Coffea, Orometallicum. In fact, calcarea ars also. Slightest emotion, in Allen's keynote it is written, slightest emotion causes palpitation of the heart. With fear and anxiety. Now, see, if the patient is suffering from anxiety, palpitation from anxiety or palpitation from fear, I would suggest that these basically are very uncommon. Of course, every individual, because of fear, because of anxiety, has different symptom. Like somebody might have palpitation, somebody might have perspiration, somebody might have urination, somebody might have other symptoms. So in that case, find out first how is the anxiety and why is the anxiety. So palpitation after anxiety, the same remedies, you can think about phosphoric acid, phosphorus, aconite, pulsatilla, spigelia, dietalis, or metallicum, arsenic, lot of remedies. So this is after anxiety. Whenever you ask questions, be a bit specific, so answering becomes very easy for me, and I also learn with that. And the second thing is fear. You can add that palpitation with anxiety and fear and semen. The remedies would be very close to each other. Okay, yeah. So you have done it. So I hope this part is over. You must ask. There was a case where the patient came and told me, whenever I suffer from headache, I have palpitation. So palpitation, headache during, and this is a very very important symptom, and then your remedy will come out beautifully. So in cases of migraine, if the patient is telling you this symptom that there is palpitation during headache, think about spigelia, think about ammonium carb, also think about argentum nitricum. See, palpitation everybody remembers because it is related to heart and people are very anxious and scared. So they would remember this symptom very, very properly, my dear friends. So think about these remedies also. Okay. In palpitation, just I would like to add one thing. If it's a lady patient, then please ask that palpitation is before, during, or after menses. Sometimes you don't expect palpitation after menses, but if there is palpitation after menses, then think about natramute. So before menses palpitation, sometimes you can miss out, but palpitation after the menses is very very important. Also keep important. Okay, a very big abscess on knee full of pus, can silicia be given? Why not? Silicia, any remedy related to pus can be given, my dear friend. Think about silicia, think about sulfur, think about Hipparsulf, think about myristica, think about gunpowder. Just go home and read these remedies I have told you, and you will get finer and very subtle difference between the pus and the discharge, the character and the color of discharge, and you'll be able to crack the case very easily. Otherwise, in homeopathy, whenever we see pus, I also, including me, we either tend to give silicia or we tend to give Hipparsulf. But if it's a big abscess, go home and read the difference between the remedies which I have told you. In about 80% of cases, this remedy would help and give you results. Okay, just I hope the question is answered, my dear friend. If not, then you can ask me. I'll again give you something. But just one thought which I wanted to just complete with you, that if the patient comes and tells you that I have skipped my menses, and because of that I have palpitation, and this happens every time, in that is a very very important symptom, palpitation from suppressed menses. Of course, pulsatile is there everywhere, but think about cactus grandiflorus, think about viratramal, think about natromure also, my dear friend. I'll just take a question before I answer. Fever with pus. Now, whenever there is fever, in most of the cases, you will most of the cases abscess will have fever, because the whole constitution is able to fight that. So it is trying to protect you. So this again becomes a normal symptom. So don't prescribe on that, because you might not be able to crack the case. In most of the cases, ask the character of pus. In gunpowder, it is a bit blackish in color. In silicia, it is a bit liquid in color. In Hipparsulf, it is a bit thick. So these type of differentiation, if you read properly, automatically you will be able to prescribe the medicine. So today's homework for you all will be the character of pus and the quality of discharge. So next YouTube live, I would ask you differentiate between these remedies, and we'll learn at that time also. Hello sir, patient keeps thinking about his previous electrocutions fights. He has persistent thoughts and about how could it have been different. What rubric persistent thought should we take? Yeah, why not? You can take that. But this patient, somebody asked me, sir, you don't get irritated. You don't get irritated while you're teaching. And I told, I get irritated at some questions, and this is the same thing. So if a person is persistently asking this, and he irritates everybody at home, then you have to take a rubric which is better than that. Torments everybody with his complaints. Torments everybody with his complaint. Then you come to calicaricarp and zingum metallicum. Are you with me? Yeah. Otherwise, you can you can take the rubric thoughts persistent. But if you ask me, I would have prescribed this rubric. The patient is so obstinate, the thought of anything, not only the fight, not only the fight, but whatever goes, he keeps on thinking. So thought persistent is very, very important, and sometimes the thought does not have a meaning also. So if you see the thought persistence rubric, there are remedies more related to narcotic and acting on the sensorium, like cannabis indica, cannabis sativa, these type of remedies. Okay. Yeah, thank you so much. So this is very important. Then what does the thought make the patient feel? Whether that because of that thought the patient becomes sad, because of that thought the patient has weeping, because of that thought the patient becomes abusive, because of that thought the patient becomes whatever hyper, and the patient or after that thought then again it comes back to normal. So sadness or irritation or thought alternating with that becomes an important symptom. Okay, so thank you for some good and lovely questions, and I hope you enjoyed as much as I enjoy sharing knowledge with you. Thank you so much. Until next Thursday for Instagram Live. Thank you so much.